In a healthy future, where will you access healthcare? Ken and Judy Jones both have type 2 diabetes, a chronic disease that, when left unmanaged, causes health complications that are both disabling and expensive. Ken and Judy share the same primary care physician who has given them both the best care from his clinic. But unlike Judy, Ken still struggles to manage his diabetes, and he's felt helpless and frustrated. Ken's physician enrolls him into a new intensive program that connects him with online education, virtual visits, which is a video chat with his care team, and connects his glucometer, which measures his blood sugar, and his blood pressure cuff to alert his care team whenever his measurements are off. It's one of these moments where Ken receives a call from his care manager, and she invites him into a virtual visit to walk through whatever had been happening before the alert. Ken describes that he was preparing a healthy meal, including fresh-cut pineapple, and before eating decided to take his measurement. So she asks him to take another measurement, and this time she'd watch his technique. So he walks over to his equipment, and before he pricks his finger, she says, "Now, wait a minute. Aren't you forgetting something?" And that's where Ken has one of his great learning moments. See, for whatever reason, Ken never really valued the importance of washing his hands before taking his measurement. And there he stood in his own kitchen with sticky fingers, and the sugar from the pineapple juice was affecting and contaminating his blood sample for his measurement. So after that, Ken always remembered to wash his hands. His measurements were more accurate, so he was able to manage his disease. And as one of our diabetes educators often says, while uncontrolled diabetes is the cause of just awful complications, controlled diabetes is the cause of nothing. This is an example where very simple technology allowed Ken's healthcare team to reach him where he was and when he needed it. It was built on the established relationship with his primary care physician, but it shifted care from the clinic into his home where he lived in his natural environment. All of his other care had been delivered in the clinic. Now, clinics and hospitals have come a long way since the doctor who'd hang a shingle and do home visits with a little black bag. Lately, we've been building very large medical clinics, multi-specialty places where all kinds of services are available in one convenient location in the community. And we've been building these year after year, which is fantastic, but even with these centers, they're very expensive, and we'll never be able to have them in every community. And we'll never be able to have all the specialists we want to be there available every day. And many of the services, of course, will not be available beyond normal business hours. And so, how can we connect with our healthcare teams anywhere we are and anywhere we need them? In 2010, we started to put together a service of urgent care through phone consultations and these virtual webcam visits, and in certain cases, a home visit from a doctor. And we got really excited about this. We did our research, we did focus groups. Since insurance wasn't paying for any of this at the time, the focus group suggested that you pay $19.95 a month, put it on your credit card, but you'd have unlimited access to use this whenever you needed it. And so we put the team together, and we chose 3 clinics where we were going to launch this, and we launched. And after 3 months, we had a grand total of 1 patient who had enrolled. And that 1 patient had had 0 visits. And when we contacted her to find out what it was that had attracted her to sign up on the service, she had absolutely no idea what we were talking about. So we quickly unsubscribed her and went back to the drawing board. See, it's a new service, so patients didn't really know what to expect or what this was about. They didn't know when they'd need to use it or what it would really get them. And the care team that was kind of encouraged to promote this wouldn't recommend it because they weren't clear on the clinical evidence, and they weren't familiar with what it was like or what it would do to impact their patient relationship. So this was an opportunity for us to, in the end, we offered this to our employees, thousands of employees, and we gained all of that experience to come back and better connect that service with all of our local primary care clinics. And that helped us turn a pretty terrible failure into a great success. Within the next year, we were offering this across the region, and we've been seeing patients every day. And this is now a practice that's broadly available across the nation through many organizations. That experience also showed us that it takes a dedicated clinical team to be able to do this. And it opened our eyes to many other clinical teams. We're starting to provide services across the region. Flash forward to today, where just a few of the leading health systems are starting to bring more and more of these clinical teams together into one location and forming the first virtual hospitals. Today, 150 of our care team members, nurses, nursing assistants, technicians, and physicians, are all there providing care across the region to our hospitals and clinics and into the home. Our transfer center team helps connect hospital patients to the care they need when they need it. Our staffing office helps schedule and deploy clinical staff throughout our facilities in the region. Here is our monitor tech team, and they're looking at heart rhythms for patients across the hospitals. And at the touch of a button on their touchscreen, they're able to be instantly talking with the bedside care team. Right around the corner are some of our most experienced critical care nurses and physicians. And they're using our electronic medical records and clinical dashboards and predictive analytics, helping our bedside care teams watch for trends in our critical care patients' recoveries or declines. And they're helping to ensure that every critical care patient receives the best care according to whatever's happening in real time. And they also are able to, with a touch of a button, video chat with our patients or the bedside team. What's really exciting about this is that it's here. These clinical teams just now do exist. And although the services that they provide now make sense, what's really exciting to me is that these are teams that are not constrained to the facility that they're in to be able to deliver care. One of the medical directors in the Northwest here started asking his hospital patients, if we could have provided all of the care that you received here in your hospital stay in your home, if we had had nurses and physicians and the equipment to be able to deliver into your home, if you could have had all of that safely and we could have brought you into the hospital only when you needed it, would you do it? And most of his patients said yes. See, we're at a place where more and more advances in medical technology and in-home diagnostics and clinical practice are going to allow us to provide more and more care into the home. So whether connecting you to your care team for chronic disease management or addressing urgent issues as they arise or delivering hospital-level care into your home, I believe that a healthy future includes delivering care to patients wherever they are and whenever they need it. And so in the spirit of that medical director, tonight I would ask you, think back on the last time you received any kind of health care. And if you could have received that care in your home, would you? Thank you.